It's putting the patient at the center of their health care, empowering them to help in making their healthcare decisions and to be an important factor in guiding how their health is going to be. By using good communication skills, informing the patient, having open and honest discussions with the patient, and then sharing information with other care providers and truly working as a team, we can empower the patient to be more proactive in their health care. So with our new breast cancer center, we have a nurse navigator who helps get involved in the patient's care. And she sits side by side with the patient, walking her through the different levels of interaction with the healthcare system. When a patient comes in to have a mammogram, there's a certain level of anxiety that's involved in what could the findings be. If she gets called back for a diagnostic mammogram, that says to the patient that we found something wrong. While most of the time that turns out to be a benign process, it's still very anxiety-provoking. And when the nurse navigator is there to help her walk that patient through the steps, reassure her along the way, explain what's going to happen next and what those medical terms might mean and what the outcomes might mean, it's very reassuring. So that's one example of how we have more of an interdisciplinary team working to help the patient get the most out of their care. This level of teamwork and interdisciplinary care makes the patient feel well cared for, listened to, and that they're in expert hands. And those are the three things that patients have stated in studies and interviews that are the most important to them. I have a great example that just happened recently with one of my patients. She was at the breast center and had an abnormal mammogram and was called back for the diagnostic. And the radiologist felt that the lesion that they saw on the mammogram needed to be biopsied. So the radiologist did the biopsy, and when the pathologist then looked at the sample, they found only benign findings, which was great. However, the radiologist felt that the pathology report didn't quite match what he was seeing on the mammogram. So the radiologist x-rayed the tissue that they had to confirm that the calcifications seen on the mammogram matched what he had sampled. He notified the pathologist that he wanted the pathologist to look deeper into the tissue sample. He notified me to let me know what was going on and why there was a delay in diagnosis so that I could then inform the patient that there would be a delay. We still think things are going to be benign and turn out okay. The patient was extremely appreciative to know, again, why there was a delay and that we were taking these extra steps to make sure that we could come back to her with a very safe, secure, and confident diagnosis. And that level of ownership and that level of teamwork, I thought, spoke very highly of how well our system works and how much we care about having a good outcome for the patient. I think that we can all work very hard to make sure the patient is informed and understands that we're all looking out for their care. And it comes down to the very simple things: sitting down with the patient, looking at the patient eye to eye, being fully present, using their name, knowing the background, so reviewing the chart before we interact with the patient so that we're fully aware of everything that's happened up to that point, and then being open and honest with our communication with the patient and with each other.